Well, it empowers people to make decisions when they are given that information. And that's the one thing Shawn and I have really liked about um, health sharing, is that you're not locked in. You're not locked into just one size fits all, or that square and circle that you were talking about. That there's options, and that puts you in the driver's seat. So if you have an insurance company, they're in the driver's seat, and they're in the driver's seat of your physician or your oncologist or everything. And we've touched on that. So tell us a little bit about how you are freeing your members in a way that they can take it, not only just because I really strongly believe when we are bankrupting our patients, that's harming. It's really against the oath of Hippocratic oath. That is part of harming, and then not treating them in a way that's beneficial or giving them the best options, I believe, is harming them too, because we're just putting blinders on. So tell us how this is so much different for people in the financial part.
Yeah, so I mean, even something so we just see year over year, because of these interests of big insurance, big hospital, big pharma, these costs just continue to escalate, right? And so this is where one of the things we do is, even if you need this emergency surgery again, and you're at a hospital system that's having huge costs. 500, 600% of Medicare costs. I mean, just astronomical. I had a case, give this example. I had a case of nasal polyp surgery. It was a couple years ago. Nasal polyp surgery. Hospital and doctor wanted to be able to charge $96,000 for just a removal of a nasal polyp. Okay. I'm like,
Wow.
this came across my desk. I said, this is not going to happen. We need to hold on. We need to be able to actually direct. We were able to get to a provider in the same zip code, literally different provider, different hospital, where the actual procedure, any guess for this actual procedure, what the actual cost of this
I'm gonna
was?
guess 5 grand. 5 grand.
Oh, and Shawn, you're so close. 6 grand. Six
Wow.
grand for this actual total procedure. So this is
It's
where
a
when you
scam.
start to say, and guess what? It's fraudulent. And it happens
I mean,
because
imagine this,
there's lack
John.
of
Sorry,
transparency.
I
Yeah,
get
go ahead.
passionate about this, but imagine this, John. Imagine in the same zip code, if on one area of town, there's the same exact car that is 20-fold less expensive. We wouldn't accept it, but yet in healthcare we accept it, and we shouldn't.
That's right. Well, and because there's been blind trust.